Thank you, everybody, for joining us this morning. I encourage you to put your camera on. I know I'm not doing the presenting this morning, but having been on the presenter side, it is really helpful if I can see some faces of who I'm talking to. We don't care if you're drinking your coffee or eating your breakfast. Feel free to go ahead and put that camera on. So just a couple of housekeeping things. We are recording this. Connie just typed into the chat the link to the mental health toolkit that she's going to be talking about today. So if you wanted to take a look at that and follow along on your own, you can do that. I'm also going to be sending along with a link to the recording, a copy of the slides, and I will also make sure that you get that link as well when I send that out in an email. That'll probably be later on today or maybe tomorrow. I wanted to talk for a minute, just the reason for doing this. I've seen in the workplace more and more that we've got employers who are being faced with the challenge of assisting an employee who is experiencing some sort of a mental health issue. And as we all know, those lines between home and work really are blurred. They're really one and the same. And when an employee is having issues outside of work, it very often carries over into the workplace. And we as HR professionals or as managers in our organization, we're not mental health professionals. We don't necessarily know where to go with this. So thankfully, United Way of Northwest Vermont has a program called Working Bridges, and they have developed a toolkit that should be really helpful for you in the workplace. If you have an employee who is experiencing some sort of an issue, it kind of gives you a guide for how you can help them, how you can support them, and where you can direct them to get some of the help that they need. So I'm going to turn it over to Connie. She is from the Working Bridges program. We are really happy to have her here today. So Connie, I'm going to turn it over to you.
Thank you, Susan, and NFP. Thank you for having us and for letting us have space with all of you and for all of you to show up. And Kate, is that a cat on your shirt? Please tell me it is. That is lovely.
Yeah, there's actually a mouse on the back too. It's playing in the yard.
You win for the day. That just made my day. So thanks for showing up and bringing the cat. And I am here to talk with you about some hard stuff today, but also what I hope I can leave you with some helpful tools and resources and tips on how mental health is showing up in workplaces and different ways employers are starting to look at that and address that, and ways that we can shift stigma in workplaces around mental health. I think all of you here probably have experience seeing employees in that challenge dealing with mental health. So our goal as Working Bridges is not only to provide that help through resource coordination, but to provide information, education, and connection to those resources for our employer community. So, you get me now. So this is my face. That's my face there too. And I'm the Working Bridges director with United Way of Northwest Vermont, and I'm in my 9th year. And I started on the team as a resource coordinator serving employees in workplaces, and over time have watched complex issues that employees bring into the workplace, and have watched that, have witnessed employees succeed and grow in their resilience. And the work has grown. We've expanded in lots of ways. I'll tell you, so the reason though for me doing this, the reason I get up every day, the reason I'll get up and I'll meet employees on a production line at 6 a.m. is because I value that relationship building. I value that opportunity to meet people where they are. And workplaces are a platform for support and services. People connect there in a really natural way. And workplaces are communities within a community, right? Think of it as like there are resources and supports and benefits within a company, and then outside in the community, there are resources, benefits, and supports. So it's nice to have that liaison. And I just, as a young person, I experienced scarcity of resources in my family, and yet at the root of my family was this high value placed on work and pulling yourself up by your bootstraps. And if you could just work hard, you'll get what you need. But what I do know is that it takes more than earned income, right? It takes more than a job to make it so you can be there fully for both your family and your work. So that's me. You get two, you get the real one and a picture. It's on the website. I don't like it. It's terrible. So today's, I think our time together, just to give us a little structure for our time. These are some of our objectives or things I hope we can cover, but I also hope that you'll feel free to unmute yourself or drop a question in the chat at any time, because we can stop and go where you want to go. But today, I think we'll spend some time talking together about how you as an employer can support mental health and the mental health of your employees in your workplace. We're going to talk about the guide that I shared in the link, and I call it a toolkit, guide, call it whatever you want. But there are pieces to that I think you can take and use in different settings, and we'll walk through some of it so you feel prepared to share with your teams. And we'll make sure that you have a good sense of what United Way does, what Working Bridges is, and what other resources are available to support your teams. And I think really, I hope today you'll feel safe being able to talk about all the hard things. I think some of you might even be in a place right now where you know you have an employee that's struggling. Maybe they have a mental health issue right now that's bubbling up or interfering in their job. And so I want to create space today to be able to have that sharing. If you want to be able to talk about that, know that you're welcome to bring up what you need and ask for that today. So let's see. So to do that, I think I always like to just set the stage with some general agreements and setting some safety for everyone that's on this call with us. So please share, go where you need to, ask your questions, share examples and scenarios, but please know that whatever we share will stay in this virtual space with us, and that we're going to be able to kind of keep things as confidential as possible, respecting everyone's sort of situations and things that are happening. I also expect we'll have some imperfect ideas, right? Because when we learn something new, sometimes we come up with an idea and it's not fully formed, and that is okay. However, if we do cause harm, hurt, or offense, let's be accountable to that. And so we'll certainly hold each other accountable to that. And but we're here with best intent, respect, and trust each other. But take care of yourself too. Please eat, drink, do something. But I thank you for leaving your videos on or your cameras on, because it does help me gauge where people are at and what you need. And I can even see if you raise your hand or fall out of your chair. So send help. We think someone's fallen out of their chair. So I think the other piece too, take care of yourself in the moment, but later on, if things get hard, I just want to, there could be other mental health first aiders in the space. I'm a mental health first aider. So if we talk about things that are hard or you need to decompress later on, I'm going to make sure you have my number and my email, and I'm available to you. So Susan knows how to get me. I just want to make sure that you know that if something comes up for you that's really pressing or difficult, I'd be happy to talk with you about that later on. We're not in a situation where we need a photo release, so just ignore that. See how easy that was? Anything else that others might need in order for us to have a good time together, please let me know. Feel free to mention that. So I'm just going to give you the high level, what is United Way? So Working Bridges is part of United Way of Northwest Vermont. And how many of you know about United Way of Northwest Vermont? Can you raise your hands if you do? I see hands. Okay, some hands. United Ways are not all the same, right? So there's United Way Worldwide. There are lots of chapters of United Way. United Way of Northwest Vermont is a collective impact agency. So we work really you'll hear us talk about working at the intersection of nonprofits, government, and private sector. So we bring people together to solve our most pressing challenges. We bring people together on issues that our community sets and defines and helps us understand as our most important needs. These are our priority areas. All the work that we do drives these parts of our community's needs, whether it's work around prevention and reducing substance misuse, whether it's working bridges and providing financial coaching and fostering financial stability. It could also be meeting basic needs through our program funding that goes out to community nonprofits, or promoting mental health, like United Way's mental health initiative, which I'll talk about later on, or supporting families through our program funding or other direct programming, or Vermont 211. So depending on what our strategy is, it aligns with these priorities. That's high level stuff. Who needs that? So we're like tactically, like this is a tactical strategy that we have at Working Bridges. And we're in our 17th year. I like to think of like telling people we're almost adults, but not yet 21. Trouble. So we work hard, we've grown over time. And when we first started, it took 3 employers in our community who went to a Bridges Out of Poverty session to come to us and say, hey, I see issues of generational poverty. I see scarcity of resources that affect my employees' ability to be at work. Help us figure out a strategy to address this in-house. We need support inside. So we designed this program with the help of our employers driving that. And so it was designed around the idea of improving employee retention, advancement, being present and having financial stability for our workforce, our collective workforce. And we do that by supporting employees with available resources right at work. And we do it for a lot of different reasons. We have lots of motivations, but these are probably the ones that are most important to take away, because we know that, we see great employees, excellent employees that can get derailed by some of these most important infrastructure needs: housing, transportation, childcare, money matters, family matters, healthcare needs, belonging, community, mental health. All of those resources we call essential resources. And in order to be present at work and to fully show up in our lives, both at work and with family, we need these things, right? We also hold true, like this real high value on the fact that a job is a pathway to economic mobility, right? It's a path to financial stability. And we see that, but we know that a job isn't the only thing, right? These other resources have to align in order for us to all be here. And if we just took a second, just take a second right now and ask yourself, what did I rely on to be at this meeting today? What was important that I had in my life? What resources did I have to show up? And you don't have to, that's sort of just a reflection question, because you're probably going through the list of, okay, well, I had a warm place to sleep. I had food, breakfast, coffee. I had childcare lined up. I have transportation. I have steady Wi-Fi access. I have technology. I have cognitive abilities to be able to make sense of all of these things I had to do in order to be here for 9 a.m. You have all of those things, and often we don't see those until they aren't there. So a little bit more of the why. We are, as I said, rooted with Bridges Out of Poverty, but these days we talk more about the science of scarcity and the impact that scarcity has on our brain. So when we talk with supervisors and managers and teams, we like to spend time on that concept. And you can read the book Scarcity by Mullainathan and Shafir, and it will really help you to understand behavior from the lens of what happens with our brains, right? Everyone here, our brains will act the same way. It's just the impact might look different. If we don't have enough of what we need, it definitely impacts how we make decisions, how we navigate resources, how we show up. So lastly, we meet people where they are. I look really good in a hairnet. And so we show up at work and we walk lines and we talk to people, and we literally will meet people at their job just to connect with them about resources to see how they're doing. And then at the really sort of this larger message of just recognizing that access and equity and justice can pave the way for our community and for everyone to get what they need. So Working Bridges, I'm going to give you the 4 buckets. Really, it's 3 buckets and a thread, but these are really the key parts of our initiative. These are the things that we really spend our days focused on. At the heart, our keystone strategy is called resource coordination. And that's in Northwest Vermont, we have a team of 7. I like to call us the Magnificent Seven. Has anyone seen that movie? Come on, seriously? Am I the only one? Come on. Yes, Deborah, come on. All right, don't make me the only one, because I was like, it's a good one. It's a Western. Anyway. Resource coordination is it's our team of highly trained community resource experts. They're all community resource specialists. They go into workplaces and provide on-site confidential support with employees on all non-work related things, all the stuff around work. We are financial coaches, we are recovery coaches, and we're mental health first aiders. We're not clinicians, we're not counselors, but we're humans that care, and we come in and we work with people. We help people with paperwork, we help people with access, advocacy, we help people research and understand different systems like the IRS, or how does health insurance work? I have this medical bill, or all of the things that you have to deal with. But if you've never had experience or a model or someone to help you understand those systems, or maybe you're new to the country, those are going to be pretty tricky and can really throw you off or create barriers for you if you can't access them. So we also provide supervisor manager training around issues of scarcity and things like this, where we're able to talk about resources and share and educate people about what's out there. And we do some employee-facing lunch and learns, and these are usually with our community partners, people that are that we work with in housing or in the food scarcity work. Or this week we had a session with Vermont Legal Aid and the Low Income Taxpayer Clinic to share information about the basics of taxes and tax withholding. Really, just some of this knowledge that's out there, we just bring to the workplace. We provide reports. So what's really helpful, I think, in this work is it's not just service delivery, it's also feeding the system, right? This idea of reporting back to our employer partners what we see with employees, what are the connections, what are the needs, and then being able to sort of have those conversations with employers and the network at large, and so that we can collectively use our voice toward change and the pursuit of resources, funding resources or change. So there's this innovative quality that's built in, and that's the fun stuff, right? That's the stuff where we get to try new things and address the gap, right? Because that's sometimes where our employees will sit. They sit in a gap, there might not be an immediate resource, and we have to support them through that. But this last bucket isn't really a bucket. It's more of like I should get like a thread or something, because it really, at every level, we're building relationships, both with our employer partners who trust us to let us come in and do this work, both with employees who we get to work with in some of the most difficult places that they might experience in their lives, and some of the most joyful, that we get to share that space with them. And then with our community partners that are in service delivery and trying to support our community. So we have really just a lot of relationship building happening. You'll see our current partners who we're working with and where we're able to go right now. The employees that we work with are generally in manufacturing companies. Some of them are in healthcare companies or home health or residential care. We work with higher education as well, mostly students, but also staff. And some childcare partners we've worked in hospitality and retail. The work can happen anywhere. Ultimately, that's the way we like to think. We're pretty mobile. And so that's just a picture of where we go and where we're serving employees. But I want to ground us a little bit in the reason we're here today, like what's important about this conversation. I realize this is top of mind for most of our employer partners, the folks that I get to work with day in, day out. And I think, I imagine for much smaller shops and much smaller companies, it's even more overwhelming potentially, because many of you are wearing all of your hats, maybe all at once sometimes. And that, I think, can feel overwhelming and like a heavy burden. So I think having this time together, realizing that you're here today because you already recognize that your workplace can play a big role in how in your employees' lives, right? You know that already just because you're here. And so you can check that off your list. I was talking to Susan and we were thinking about the fact that you're taking time right now to think about this more and to ask some questions and learn and take this back. The fact that you're already doing that, that's already a task that you can say, all right, I've made this a priority. Because we know work affects our physical and mental health, right? It's in good ways and bad. And COVID-19 definitely, as Susan said, it just like opens the door, right? We see into people's lives in ways we didn't see before. And so now we understand some of the burdens, the challenges, we understand the assets and the resources differently, and we can't claw that back. That's not going to go away. So one of the things I like to do is make sure everyone has a general idea of like, what's mental health, right? I think that's always a good place for us to start. And this slide kind of, I think, gives a good clarity on what we're talking about today. So mental health, it includes emotional, psychological, and social well-being and affects how we think, feel, and act. It helps us determine how we handle stress, relate to others, and make choices. Poor mental health and mental illness are not the same. A person can experience poor mental health, but not have a diagnosis. Likewise, a person diagnosed with mental illness can experience periods of physical, mental, and social well-being or periods of recovery. The thing about it, if we distill this down, what's important, I think, to share with you and your teams is that we all have mental health, right? Everybody, just like we all have brains. We all have brains. And so this is an important message as we start to think about how do you destigmatize these conversations. We all have physical health. And I was telling someone yesterday, and this may sound crass, and I don't mean to be crass, but I was in a break room at one of the manufacturing sites, and it was easier for me to talk to mid-50 something man about his colonoscopy than it would have been for us to have talked about his mental health. And that says a lot, doesn't it? That I can say, hey, Bob, how was your colonoscopy? But I couldn't have seen myself being able to say, hey, Bob, how was that counseling appointment? Right? So that's the stigma that we're here today to talk about and figure out. What we've done well with our physical health is be able to promote that as a preventative measure and talk about it as everybody has physical health. So we're going to talk about it. And we're going to be comfortable with that because it's what you have to do to manage this body that you have to have. And so is your mental health. So I think now that we understand what we're talking about, here are some recent data points that I think really can illustrate the opportunity at hand. And this might help to inform your priorities in the direction that you want to go. The Surgeon General shared these points maybe 6 months ago. And so 76% of US workers reported at least one symptom of a mental health condition. 84% said their workplace conditions contributed to at least one mental health challenge. And this is important. 81% of workers reported that they will be looking for workplaces that support mental health in the future. So this one really sticks to me. And it made me think, as we are in this workforce shortage, and we're struggling to have enough staff to do the jobs, I do think there is something about prioritizing benefits and supports that will show up and support employee mental health, right? That is a direction that can support recruitment, it can support retention, and it certainly can have deep impact. And people are saying, this is what we want. We want to have a workplace where I know I can get these needs met. The other thing that's profound is that 1 in 5 adults will experience a mental illness in a given year. And that was pre-COVID numbers. So we'll wait and see, but I suspect it'll be 1 in 4, just because I think COVID pushed people to that place where they were able to they may have experienced their first mental health issue ever. It was a great strain on all of us. Another, I found these polling results also very helpful in thinking about what's out there, what's the issue right now. Roughly 3 in 4 employees indicated they struggled with at least one issue that affected their mental health. 2 in 5 employees diagnosed with mental health disorder. This was just from Harris poll. And I think, so while employees are looking for jobs that have mental health supports or that can be supportive of mental health, this last point, like many were willing to divulge their disorder in this confidential survey, but 63% of those diagnosed with a disorder say they have not disclosed it to their employer. So I think that, like, if we think of that, people need mental health supports, but they're not able to talk about it. So we've got a stigma gap. We've got this space where people are suffering in silence potentially, but not getting, they're in that space. It just feels a bit like there's some work to be done on having these conversations. You'll see this in the toolkit, because I do think for those of us that are mindful of where we're putting our dollars, this is helpful. This could be a helpful gauge. This is the amount. So about $5,000 is the annual cost of days lost per employee due to mental distress or mental, we call it mental health days, right? Those sick days. And then the annual cost per employee for turnover due to lack of mental health support. And, these numbers are from the National Safety Council. And so it's national numbers. But I think if you just think of it in that frame, it helps us to start thinking about how much per employee could I invest in this, and why would I? Where can I go with that information? So let's come down and talk about Vermont, because that's where we spend our time. And that's who we are. And employees that we worked with in 2022, and this was year to date, maybe 3 months ago, you'll see this pie chart that shows that overwhelmingly 62%, when people sought out mental health services and supports from their resource coordinator, often it looked like we call it listening support. And sometimes that's just someone being able to come up with their own plan, right? It's giving people space to figure out what they need, what they're doing, and to be able to talk to someone they trust about that situation. Mental health referrals and substance use recovery referrals were part of those conversations. And you'll see we drilled down a little further so you could see what kinds of services were related to mental health and substance use disorder. These are the kinds of things employees were looking for. And I think it's important for us to say a very small amount are crisis services. So we're not talking about, not every situation around mental health is a crisis. Sometimes these are they can be associated with substance use. There could be recovery needs or support group needs that are happening. It could be related to housing. So there are other parts of mental health, what helps people stay mentally healthy, right? And I think this slide shows that. This slide can show you some of the referrals that we make, what organizations support mental health of the employees that we worked with year to date in 2022. And you'll see that many of our referrals are in conjunction with an employee assistance program. And we can talk more about that. I'm happy to answer any questions on that too, but I think often we'll see employee assistance programs as a really essential tool that can support employees in that moment with a professional counselor or clinician available 24/7. You'll also see that there are some things that, I think the designated mental health agencies are a huge resource for us. But as you all know, there are definitely some challenges with the system right now. We don't have enough mental health counselors. And so we have some employees that are a little stuck. They're kind of in that waiting place for treatment. And that's not their fault. It's the system just not having enough resource community counselors and therapists. But you'll see on this slide, there are things we can do in between. There are things that help people in that waiting space. There are peer supports that we can draw on. So we'll spend some time talking about what those are. Maybe as we go through the toolkit, I can highlight some of those things that are really helpful when employees are struggling to get treatment or to get in somewhere. Because if you're hearing that, there might be other things that you could talk about. So resource coordinators support employees with a lot of resources. Mental health happens to be one of those issues that, well, they're all connected, aren't they? If somebody's struggling with stress in their life, maybe they've lost their housing, maybe they don't have a rental apartment in time, they're being evicted, Maybe they're expecting to grow their family, but don't feel like they have information about health insurance, or maybe they don't have the resources they need. That can be, that can cause strain, right? And under that is one's mental health and ability to cope with hard stuff. So in our conversations, often we'll get at, how is this person doing with that, right? And, resource coordinators walk through the company and talk about mental health resources. So we're able to really destigmatize it and make it normal. And that's a kind of a low-hanging fruit, right? Just sharing information in the workplace about mental health resources in the community is one way to start to show up and say, yes, we promote that here. That's important to us because we're putting it on the board, right? We're making a post on this every Monday, or at every staff meeting, we have someone that shares a resource with us. We promote employee benefits internally, support supervisors and managers. There was a recent situation where we had launched at a new site working with employees, and it was a very small site. And one of the employees had shared with me, came in tears and struggling, and very clearly having a mental health crisis, thinking about suicide and struggling to regulate, and had been missing work. After meeting with him and, using mental health first aid and being able to assess his risk, he had attempted to get treatment or counseling, but had burned a bridge and wasn't willing to go back to that counselor. So there was no immediate counseling available. That wasn't going to happen right away. He knew about employee assistance program, but he was never going to make the phone call on his own. He had also started using substances, which was increasing his symptoms, and he was having even harder time. So the next day, the plant manager messaged and said that he received a message from this employee, and the employee had indicated that he was at risk of suicide. The plant manager said to me, "I don't know what to do." So in that moment, this is an opportunity for us. We got the employee safety. So we did a wellness check, and we were able to make sure he was safe and alive. But the plant manager didn't have the tools or supports to know what to do next. So this really is one of those times where working with your teams to go through this toolkit and talk about the what ifs, and to be able to give your team some of the language around how to have the conversation can be a light touch, but a way to support your supervisors, your managers, your team leads to be ready for when that happens. This was a crisis, but it was unexpected, but it definitely, I was so glad that we were there, and that the plant manager could text and could share that, and did. And that plant manager felt empowered enough to be able to reach out and do that, right? And knew the signs enough to say, this doesn't feel right. I don't know what to do. And so those are conversations you can have. It can be over a lunch and learn style, or just conversation with this toolkit as a starting point. Good news is 2 weeks later, he came back to work, and he had light in his eyes again, and he was detoxed. And he said, "Connie, I just took 2 weeks off I haven't had from my 2 jobs in 8 years. And I feel like, I think what was happening is he was having a hard time with boundaries and being able to stop work when it stopped, and have a life outside of work that was healthy for him. He was just out of balance, right? His mental health, he needed some work, he needed some time. And he didn't go through the traditional, I'm going to see a counselor, I'm going to the hospital. He ended up talking to his mom, and that's what he needed. It was a simple thing. Anyway, not that that's like fixed the whole thing. He's got a lot of work to do, and yet it was a really simple thing that he just needed to know he could talk to his employer about having time off to deal with his mental health. Just like he would have had he broken his leg, right? All right, I'll get off that tangent. But this was profound to me too, this quote, right? It's really simple. This was something an employee shared with us through one of our surveys, like a satisfaction survey. And the employee wrote, "It felt like someone was honestly looking out for me." So isn't that at the root of all of it, right? And isn't that what we want at our workplaces? That people look out for each other? That is the message. Okay, time check. we're okay. So this is the guide. And I wanted to just take a minute before we get into it and open it up a little and see. Actually, I'm going to stop sharing. No, I'm not. I'll leave it on. I was going to just see how are people doing with this? I just want to have a touch point with all of you and hear from you. What is resonating for you right now? Like, where is your mind at? I want to take a minute and just hear what's on your mind. I've just shared a lot about United Way, Working Bridges, why we do what we do. I want to get into some of the tangible things and the resources, but I first want to hear, like, where's your mind at? What are you hoping for? And, Michelle, I see your hand. Go ahead.
Yes, I would. So I guess I'm an HR department of one at a not-for-profit, and what we currently have the employee assistance program in place here, and pretty much, I guess my question would be like, how do we know a little bit more about what the boundaries are? So for example, I had an employee who, like, from my past knowledge, was going through a domestic violence situation.
Mhm.
And that situation was causing her to miss work, some kind of abusive situation that was causing her to miss work. And at the time, there was a part of me that wanted to recommend for the employee to go to WISE, but the employee was not declaring that they were in an abusive relationship. They were doing the kind of backpedal, oh, he's not that bad, and blah blah blah,
Yeah.
But it was a word. So it's kind of like, how do we balance that whole, like,
Yeah.
'cause it can be dangerous. I'm wondering what our liability is and what we open ourselves up to as an employer if we say, oh, hey, go to WISE or something like that. In giving the resources, what are we? It's kind of almost a thing of, I'm wondering, like, do we can offer the EAP, and that was my guidance on that, is you refer them to, we have the EAP, we refer them to the EAP where all of those community resources are in there.
Mhm.
Is that sufficient, or do you feel that the employers need to actually refer them to specific resources and stuff like that?
I think that that's a really important question, Michelle. Well, let's just think on this. So employee assistance programs are essential and a great referral. I don't think there's any harm in having those resources available, right? Making people informed and educated about them, being able to put them on boards and have them there so that employees can take it upon themselves to connect with those resources or to learn more about them. When I do think, there's this question, Michelle, an employee, there was the plant manager that I talked with who said, this is so interesting because he has the same concern or worry. He said, I don't ask. I know an employee suffers, is having a hard time, and I avoid him because I don't want to talk about it, because if I learn more, then I got to do something about it, but I don't know what that thing is. It was sort of that question of like, I don't
We're
know.
mandatory reporters too, so it's very tough in our job as being mandatory reporters.
Yeah.
When we hear, and it's also a thing of, like, how do you avoid, like, if someone discloses that they have a mental health issue at work, how do you avoid that becoming the scapegoat of, oh, I'm late all the time and I'm gonna, because we want to be sympathetic to the needs of the employee, but at the same time we have to uphold our, like, when I had with this employee, we had to reiterate, this is the employee assistance program, this job has an expectation that you be here,
Mhm.
so it's kind of like, how do you walk that boundary of being compassionate,
Yeah.
also being firm, but also not opening yourself up to be like an armchair psychologist kind of a thing.
I hear you. So this is the question of boundaries for your company, right? And there are some legal questions here too. I can't speak to those. That's where you might want to have a lawyer look at your leave policies. That could be really helpful to think
Okay,
through what we're doing in this, is if we provide parity or we don't. And I say that, so that's a different conversation.
yeah,
On the other side, there might be some resources to support thinking through what are our boundaries. So
yeah.
we'll get to this in the toolkit, but I'll go there now. There's a training called mental health first aid, right? And I do think as employers and folks here on this call, you might be really motivated to take that training, because it does talk about what are the boundaries and how far do you have to go, because it doesn't make you a mental health counselor, right? That's not what this is. It's for lay people, it's for community members, for our workplaces. So many of our
Yeah.
supervisors and managers take it to support their teams.
Mhm.
Part of that training is about where are your boundaries. And it's really, I think it's important for everyone on the call today to say, to be able to know, I might not be the person to help that employee, and that's okay. And that can be a referral to an EAP. It can, and that might be the best way. And so having healthy boundaries in the workplace is how we can help people regulate and be healthy. So sometimes that is the solution. So I think it's funny. I mean, I want people to feel comfortable asking those questions and talking about it and being able to talk about those resources and educate people. But we can't hold on to the outcome. We can't hold on to the expectation they're going to take that opportunity. And we still need to have a fair and open, transparent process as to how people show up in the workplace, right? So I don't think I answered your question at all. I think I just probably, we've presented it as this is a conversation that you've got to have and think through what works in your workplace. But I don't think there's harm in sharing the resources. Only good, right? Only good in being able to make sure people know that WISE is a resource, or that the National Domestic Violence and Sexual Violence Hotline's available, or like having those resources available. And if anything, even if people don't use them, it sends a cultural message that it's okay to have that happening. You're seen, and that you're able, we want you to get what you need. So yeah, I think that's something to continue to think through. I think there are probably some questions about what the policy is around PTO or CTO and how that's used. Some of our workplaces have, like, there are so many different policies around how people take time off and what that looks like. So I don't feel like I can speak to that with any real, there's no one way. So, yeah, I hope that helps, Michelle. I think, really good point though. Consideration, right? You want to think it through. What's our responsibility, right?
And then the flip side of that is, what if we're in a position too where we can't afford to pay the most robust salaries because we're a not-for-profit and we just had a 20% increase in our health insurance. So my part of the other part and parcel of that is I almost feel like ineffectual because I can't pay my employees more money. There's no way I could possibly help them with the rising costs of rent and food and everything else. So it's just kind of how do you provide meaningful support, at a time when a lot of the stuff is just, I mean, I have families that are paying like, $600 a pay period for their insurance, and that's like, it's a tough kind of a deal right now.
Michelle, the economic conditions are, like, I think everyone on this call is feeling some similar pain points, and our team feels it. We feel it. I get you. Like, that is, the strain is great. Costs are higher. Wages are coming up. The safety nets aren't keeping pace. So there are hard edges right now on these.
And there's a lack of available I've heard there's large waiting lists for mental health therapists and stuff like that. So I'm just wondering what,
I'll walk us through, so that's a good segue. I'll take us through, because the first pages of the toolkit focus on what the heck can we do, right? So I think we all know what the system has right now. Well, let me go back, sorry. So let me stop sharing, because, I would rather just walk you through the toolkit itself. I think that might be easier, perhaps. I'm gonna share that. Hang on, folks, I apologize. Okay, can you see? Oh, let's see. What can you see? Can you see the guide right now?
I can see the guide.
Oh, I clicked on the wrong button. This guide, here we are.
There we go.
Thank you. Okay, here we are. Oh, by the way, that's the back of my head. We'd been outside all day and my hair was just a mess because it was windy. And I was like, Brian, why did you take that picture? So I'm giving Brian a hard time about that. Anyway, now that you know that, we can move on. So the first pages of the guide are like what Michelle was saying, like, okay, this is happening. I know it's happening. How do I do this? How do I, like, can I present these resources? And I think you can. Like, I think it's upon an employee to have agency to take steps to pursue these resources. But I think if they don't know, if people don't know about it, we shouldn't assume that people know these things. The thing, maybe a takeaway, if you leave here, how many of you know about 988? See, yeah, nobody knows. It's still early. It only launched in June-ish, maybe. So the National Suicide Prevention Lifeline, NSPL, 1-800-273-TALK, is still working, but it's now shifted to a 3-digit number, which is 988 for mental health crises across the country, right? So in Vermont, you can use 988. And instead of taking you to the police for a mental health crisis, it's going to take you to a mental health counselor, a clinician who's on call, and they will assess your safety or the person's safety. And they may activate emergency services. That might be the direction they take, but they might be able to intervene at a different level. And so if you have an employee who's in crisis, 988 it, right? Just use 988 with the person. If they can't regulate, if they're not safe, use 988 and make sure your teams know about it. So you can post 988 on your boards, right? That's something I think worth sharing. And we're trying to share more of because it had this change. And I don't think people realize that's what it is now. But it's 24/7 confidential and you're going to get someone right away. There are other resources, and I think on this list, we tried to make sure that people know about what is available, whether it's our designated mental health agencies, in our region anyway, for like Franklin, Grand Isle, Chittenden County, we have NCSS and Howard Center. But if you're like Washington County or even Northeast Kingdom, you have Washington County Mental Health Services. You might have, so those are your designated mental health agencies. You also, I think Northeast Kingdom Human Services is like the Northeast Kingdom one. So you have crisis lines that are local, and that's where you can go for that direct support. If it's less of a crisis, but you want to help people connect with a therapist, that might be one approach. Other resources that fill the gap. So, that I like to talk about that saying in England, mind the gap, because, the tube in England, there's a gap and things fall down there all the time. Pennies, gum, lollipops, people. So we sit in that space, that gap. And when you're in the gap, it can feel really painful. It can feel isolating, and it can feel like you're never going to feel relief. And it's a really crummy place to sit. And so if we as people can walk alongside the people in that space, we can lean on community-based supports. So that those can be things like the National Alliance on Mental Illness and their community support groups that they provide. These are peer-led support groups across Vermont. Some of them are virtual. We can lean on our recovery centers and our recovery coaches. We can lean on recovery meetings. If people are disclosing that they're struggling with their substance use, then we can start to activate recovery resources. We might even rely on peer support warm lines. So there's an organization called Pathways Vermont. It's a statewide peer support line for mental health needs. Pathways Vermont actually focuses on housing and housing first for people with psychiatric and mental illness. Interestingly, they've got a program and it's a peer support model. People can call their number 24/7. So if you can't get a counselor right away, then let's wrap around some of these other resources, right? Like, what other resources in community help people stay well? And you'll find them on these first 3 pages. And there are some things that are very specialized, like the Trevor Lifeline for people who identify as trans. There's a veterans crisis line. So the more you get to know your employees, certainly this might help to identify what referrals and supports make sense and how to share those. Does anyone have questions about some of these resources that I could try to answer or give more clarity on? I don't know if some of these look familiar to you, or if you have questions about any of them. I'm happy to try to respond or answer or give you what I know. So let's see. Okay, good. Moving forward, the toolkit, and I think I'll just show you the rest, but it's some common signs. So I think you can go through this with your teams. Like, this is the conversation, right? This toolkit could really be the center of a conversation with some of your staff. Even if you just shared the first 3 pages with folks so that people know about some of the resources available, that's one way you could do it. But mental health needs do show up at work, and we know it. And it can look a lot like scarcity of other resources too. So it might not always be mental health that's creating these signals, but there's no harm in looking at that and saying, hey, what's going on, right? And so before we end, I wanted to focus on the language around that, right? This idea of like, I don't have these conversations with my teams, but if you notice something and it's impacting their work, there are ways to say it gently, but with care. And so we've put just a sort of an example of, here's a phrase you could use. If you're sitting down having a performance review, or you're talking to your team member about, something they need to address, some performance issue, here's a way to get that in there, to start that conversation, right? Where you could say, I've noticed, you're showing up late lately, or you haven't been yourself lately, something's off, and it seems to be getting in the way of your job or being able to do the work with, this isn't how you've shown up before. Is something changed for you at home? Is there something going on like that could help you? I want to help you, right? I think that's, that's an opportunity. It's an opportunity to open the door a little, but no, it might not be you that can keep helping, right? It's okay to pass that on and make that referral, whether it's your EAP or some of these resources. Some other thoughts in here about building trust and building, resources that help, making connection. We'll talk a lot about how, when people experience scarcity, if only everyone had everything that they need. So it sounds like, oh, the opposite of scarcity would be abundance. Like, everyone has all the things they need. But we actually, I've been talking a lot about how the opposite of scarcity isn't abundance, it's connection. Because connection is where you get what you need, right? And you can see it in people's eyes when they feel connected, and when you help them make connection with those resources, then they feel cared for. Somebody is looking out for me. And it's not just about having a house or being able to get to work. Those are the essential tools to show up, but it's connection. And we don't have a lot of that these days. So there's some tips in here around policies and cultural shifts that you might already have, you might be doing, but you can kind of go back and take there's a checklist you could use to help you start thinking about, what are we doing already? What are things that maybe we want to do now? Like, what's our next step? So maybe this is the homework page where you take the checklist and you go back and you just, and this isn't exhaustive by any means, right? You might be doing other things that aren't even on the list. So that's a journal job for you, is to go back and write down, what are you doing right now that supports your employees' mental health? And where do you think your priorities should be to take it to the next level, or to deepen that cultural awareness or that understanding of what your workplace is about when it comes to mental health? There's some recommended employee benefits, yada, yada, bing, bang, boom. And I'm going to stop here so people can share any insights or questions we have before we close out. And so I hope that you got some key things from this. Does anyone have thoughts about what, anything that you're going to take back or take away? What do you think? I mean, tell me. I'd love to hear your voice.
Connie, I will just jump in that one of the things I love about the toolkit is the suggested language, because I think that's the hardest piece for a lot of employers, a lot of managers out there, is to just get the conversation started. What do I say? I don't want to offend them. How can I approach this? I think that's incredibly helpful. And the other thing I wanted to point out is that checklist of things that you can do in your workplace, they don't cost anything. It's not like you have to have a huge program in place where you're going to be spending a lot of money focusing on these things. These are really simple little steps that can go a long way.
Yeah. I try to think of it as like low hanging fruit, right? What are the small things, the small changes, the adjustments, because you might already be doing part of it. And if you just do one little additional part, it starts to make a big impact. Melissa, I see your hand. Do you want to say something?
Yeah, thank you. So I think that toolkit looks just wonderful, really helpful. I would like to kind of echo what I think Michelle Pinard said earlier. Like, it's really hard to know where to draw the line, it's such a fine line to walk sometimes when you want to help someone and be sympathetic and empathetic, but it's like, whoa, it's just, and it's a struggle also because most of us are not lawyers. So it's like,
Yeah.
we have to, it's your job to obviously want to help employees, but it's your job to protect the firm too.
Yeah.
But anyway, my question is also with regard to, are you aware of a set of resources in New Hampshire? And we're not only in Vermont. So I'm just wondering if you can offer some, maybe send an email after or whatever, or send some recommendations.
Melissa, my initial thought is, so there's a United Way in Vermont that straddles Vermont, New Hampshire's border. It's called Granite United Way.
Okay.
And you might check them out. I think they might have insight, although 211 is a program of all of our United Ways, and New Hampshire has 211. And so you could even reach out to the New Hampshire 211. They'll have a backdoor 603 number for you, and see if they could give you some referral listings on mental health services.
Okay.
You can call them and just say, I gotta figure this out. You have, designated mental health agencies in this area, or specific crisis services that I want to know about. I think that might get you a good listing for your local space or local areas you need to think about.
Yep. Okay. Thank you.
Yeah, no, and to your point though, Melissa, so creating some space at work for this is because of the many roles. And I see that. I know that's why many of the employers we work with bring in a resource coordinator, because we can sit in that space. We don't have the same relationship to the company, right? Because I work for United Way of Northwest Vermont, and I just get to come into the workplace. I don't have to have that layer of pressure on me. Not every workplace can create that you're not everyone is going to be able to have a resource coordinator. But I think then the question becomes more about fine-tuning boundaries, right? Really starting to understand your comfort, the culture of your workplace, and where, how far is where you want to go. All right. And what indicators do you look for in order to either back off or keep working alongside someone? We can talk about boundaries all day long. I love them. They're so great. I'm a big fan. No, anyway, any other thoughts or questions? It's 10 o'clock. I don't want to keep you. I know you've got to get to your day. I feel like we could spend all day. So thank you, Susan.
Thank you so much, Connie. Thank you, everybody, for coming. As I said before, you will be getting a link to this recording. I would encourage you all to download that mental health toolkit. And as Connie said, it's not necessarily an HR function. Share it with your managers. These are the people that are out there. They're the ones that are the most in touch with their employees, and they're likely the ones that are going to be the least comfortable having these conversations. So by all means, go over this with your employees so that they're getting more comfortable with it. So their first reaction isn't to look the other way or to say, go see HR, because they need to be making this connection with their employees as well. So thank you, everybody. I hope you got something out of it, and take a look for my email. It should be coming out within the next day or two. Thanks, everybody.
Bye.
Thank you.
Bye.